This video covers tools for service development. It aims to introduce you to the principles of service quality. We'll be exploring some common tools for service development, and we'll also discuss quality assurance. So what is quality improvement? Well, quality improvement is the systematic use of methods and tools to try and continuously improve quality of care and outcomes for patients. A framework from the Institute of Medicine defines 6 domains of quality healthcare. The first is safe care, so that's avoiding harm to the people we're looking after. Effective, which means providing evidence-based care and refraining from providing services that are unlikely to be of benefit. It needs to be patient-centred, so ensuring that care is responsive to individual preferences, needs and values. It should be timely, so we need to reduce waiting times for care and avoiding harmful delays. It should also be efficient, so we need to avoid waste, and equitable. We must ensure that care is of the same quality, regardless of personal characteristics such as gender, ethnicity, location, or socio-economic status. It's important that we have effective communication and patient empowerment, as these are key factors in driving quality. We need to make sure that we're developing evidence-based interventions and implementing targeted interventions that are tailored to the unique needs of organisations and patient populations. Measuring impact of these is really important for achieving better experiences and outcomes for people who use services. Healthcare quality is a multifaceted concept that encompasses providing safe, effective and patient-centred care. And drivers of healthcare quality are factors or elements that help improve the performance of healthcare systems and ensure that they deliver optimal outcomes. So there are some key drivers of healthcare quality. One is clinical effectiveness. So this means adopting evidence-based guidelines, protocols and standards of care to ensure that treatments are effective and appropriate. Patient safety, which involves minimising risk, errors and harms to patients during healthcare delivery, and that can be by implementing safety protocols such as hand hygiene, infection control measures, medication safety checks, or using technology like barcoding or electronic health records to prevent mistakes. Care, of course, needs to be patient-centred, and this is a driver of quality as it improves patient satisfaction and adherence to treatment plans and overall healthcare experiences. Timely care ensures that we are reducing waiting times for appointments, we're keeping times down for diagnostics and procedures, and we're optimising triage systems. Efficiency as a driver ensures that we are reducing administrative burdens, we're preventing duplication of care or duplication of tests, and we're using healthcare technology to help coordinate and speed up care. And that, of course, reduces healthcare costs and enhances the sustainability of our healthcare systems. All patients need to have equal access to care, so by addressing social determinants of health and using those as a driver, we can provide care in underserved communities, and that reduces disparities in health outcomes and ensures fair distribution of healthcare resources. These drivers are, of course, interconnected, meaning that the improvements in one area often positively impact others. For example, improving efficiency can free up resources to enhance patient-centred care, and focusing on engaging your workforce can lead to better safety practices. Successful organisations continuously evaluate and refine these drivers to achieve the best possible outcome for the people they're caring for. Of course, there are always barriers to quality and barriers to these healthcare drivers. So some of these include poor or invisible management. The culture of the organisation may not be one that supports quality improvement. There can be limited training and support. Your physical setting may impact what you're able to do and what you're able to change. And there may be poor allocation of resources as well, which limits the quality that can be put in place. There are a real number of service quality models that we can use to try and improve healthcare. There are many here. We're going to go over 3 that I think will be useful and most applicable to you as students. You may wish to go and research these in your own time. So the first is the PDSA. So this is the PDSA cycle, which stands for Plan, Do, Study, Act. And it's a simple yet very powerful tool used in healthcare to improve processes and achieve better outcomes. It's structured and systematic, but also quite simple. So the first step is to plan. So that's identifying a specific problem or area for improvement. So you need to define your goals. Think about what you're trying to achieve, for example, reducing wait times or improving medication safety. You develop a plan, so you determine what changes you're going to need, who's going to be involved, what resources you need. You might predict outcomes, so what do you think will be the impact of this change? And you establish some metrics, so you decide how you're going to measure success, such as error rates or satisfaction scores. So, for example, a hospital might want to reduce the time it takes to discharge women from the postnatal ward, and the plan could involve standardising the discharge process and setting a goal to cut down the average discharge time by 30%. You then do, so that involves implementing the change on a small scale to test its effectiveness. So you execute the plan in a controlled setting, such as one department or one small patient group. You document everything, you record how the process went, you note all your challenges, you note any unexpected outcomes. So that means we could test our process for discharging women faster just on one single postnatal ward for 1 week. We train everybody on the new process and we collect their feedback. We then analyse the results to see if the change led to the desired improvement. And if they did, that's great. We can compare the results with our predictions. We can think, did the change achieve the goal that we set? We can look at for patterns, successes, and areas for adjustment. So if, for example, the average discharge time decreased by 20%, but some staff were a bit confused about the process or they were unhappy with the process, we might need to make some adjustments. And then act. So you need to decide whether you're going to adopt, adjust, or abandon the change based on the results. And if the change was successful, you're going to standardise it across the organisation. But if it didn't meet your expectations, you're going to refine it and run another PDSA cycle. So it's valuable in healthcare because it reduces your risk because you just test your change on a small scale. It encourages this culture of ongoing assessment and enhancement rather than one-time fixes, which is important. It also involves staff and the people that they're caring for, so you need to get feedback from frontline staff and the people actually carrying out the change, and it should lead to better outcomes. A further model that we can look at is called the Donabedian model. It's developed by Dr. Donabedian. It's often called the Structure, Process, Outcome model, and it's a very foundational framework for assessing and improving healthcare quality. So if we start with part 1, which is structure, this refers to the organisational and environmental factors that influence healthcare delivery. So it's thinking about the physical resources. What is the hospital infrastructure? What are the equipment? What is the staffing? We need to then think about your organisational characteristics. What does the leadership look like? What are the policies and governance? Part 2 is the process. So this focuses on how the healthcare is actually delivered. So do your clinical procedures align with best practice? Is there effective communication? Is there timeliness, and is there patient safety? And then finally, the outcome component measures the results of healthcare interventions. So are patients actually getting better? For example, are mortality and morbidity rates reducing? Are patients satisfied? So it helps us evaluate healthcare by examining these 3 main components of structure, process, and outcome. Six Sigma is another approach, and this is a very data-driven approach which can be used to improve processes. The goal is to reduce errors here. It's originally come from industry rather than healthcare, and it's been adopted in. So the framework here involves define, measure, analyse, improve, and control. So the idea is you start off by defining the problem and you set some improvement goals. You measure data to understand the current issue, and you analyse it to really pinpoint the cause of these issues. In improve, you're going to implement a solution to fix the problem, and control, you put measures in place to maintain the improvements. So it's data-driven because it uses statistical analysis to find defects and to guide the improvements. And it wants to measure how well the process was operating beforehand and how the process operates after. So it's really used in healthcare to streamline processes, reduce errors, and improve patient safety and satisfaction, leading to overall better quality of care. So despite the clear benefits, there are numerous barriers that can hinder these initiatives. We're going to explore some of the most common challenges faced by the NHS. So firstly, we've got lack of time and resources. The NHS operates with stretched resources, stretched budgets, and stretched staffing, which means that healthcare professionals are often overworked and lack time or any mental energy to focus on QI projects. Budget constraints can also make it challenging to invest in necessary training, tools, or the technology needed for sustained quality improvement. There may also be some resistance to change, so cultural resistance. Staff members may not be accustomed to changing their routines. They may not resist adopting a new process, especially if they don't see the immediate benefits. And sometimes people worry that changes disrupt workflow, they actually might increase their workflow, or they might negatively impact patients in the short term. There's also a lack of training and knowledge around QI products. So not all staff are trained in QI. Methodologies like the PDSA or the Six Sigma, which can prevent them from effectively participating in or leading QI initiatives. And of course, as discussed above or discussed previously, even if training is available, they may be too busy clinically to be able to go away and upskill themselves. Often there can be poor communication and poor collaboration. So often departments are quite fragmented. We have what we call siloed working, which is where people work quite separately. There's not a lot of collaboration between them, and that makes it difficult to coordinate QI projects. And it can also mean frontline staff aren't adequately involved in decision-making processes, which really results in a lack of buy-in for QI initiatives. There are, of course, lots of competing priorities. There are many indicators of quality. There's many pieces of data that are gathered by the NHS, and staff are often under pressure to meet targets like reducing waiting times, and they might not have that mental slack to focus on the long term. And of course, unforeseen events such as the COVID-19 pandemic, can sometimes shift focus entirely. Inconsistent leadership and support is also a problem. So quality improvement requires a strong and consistent support from senior leadership. But if that leadership is fragmented or is only focused on short-term targets, QI products aren't going to receive the attention they need. And of course, if that leadership is changing a lot, that's going to disrupt the continuity there. It can be really hard to gather the correct information. So if we think about the Six Sigma, you need the data to make the changes, but it can be difficult if your IT systems are outdated or there's a lack of standardization. And even if data is collected, staff may lack the expertise to analyse it. And finally, the NHS is subject to a variety of regulatory requirements, which can shift focus towards meeting compliance rather than fostering a culture of continuous quality improvement. So there is, I would say, a strong desire within the NHS to enhance quality of care, but overcoming these barriers requires a strategic approach. It involves investing in staff training, it involves changing culture and ensuring there's good leadership support and data capture systems in order to make meaningful progress. What is quality assurance? So simply put, quality assurance is about making sure that the services meet or even exceed key quality standards. The first step in quality assurance is making sure that you've got clear, measurable standards that products or services need to meet. They may be based on regulatory requirements or the expectations of the people accessing your services. Once processes for quality are in place, we need to make sure things are ongoing. There's ongoing monitoring. So that could be inspections or audits. And the goal of quality assurance is to prevent errors before they're happening. So this involves training, clear instructions, and standardized procedures. And quality assurance isn't a one-time task. It really is about constant improvement. So we want to be continually assessing the quality of our services so that we can update our processes to avoid repeating mistakes. So how does this link to assessment? So you've been tasked with developing a service development project. You need some kind of structure to your proposal for how you're going to change practice. So use one of these. I would recommend the PDSA or the John Abedian approach. You don't need to discuss or debate the tool or critically analyse it. You just choose one and you apply it to your work. So from this information, research some of the tools that have been listed and consider the steps. And consider how you would apply it to your project. So you need to have a clear understanding of your problem. All of these service improvement models start with really understanding the problem. So have a think. Have you understood the processes, the systems at play? How do people who are experiencing the problem, how does that work for them? Have you thought about any drivers or barriers for change? And applying these to your service models will help you decide the best tool for change.